Blockbuster Laryngeal Mask Airway. Introduction. Blockbuster Laryngeal Mask Airway, a new type multifunctional device, is a tolerable airway tool, meanwhile with tracheal intubation function matched with Blockbuster endotracheal tube. Features. Blockbuster Laryngeal Mask Airway consists of mask, airway tube, connector, inflation line, inflation pilot balloon, and check valve. The connector is composed of four-way connector and a wing-type fixed handle. The wing-type fixed handle is located on two sides of the four-way connector, and the laryngeal mask airway could be fixed to both sides of the patient's mouth via it, which avoids pressing the upper and lower lips. Matched up with fixed tape, the side fixed hook can rapidly and conveniently fix the laryngeal mask airway without tape, and wing-type fixed handle is also an indicator to check whether the laryngeal mask airway is inserted into the right place. Connector is integrated with airway tube, aiming to reduce the intubation resistance. With overall inner lumen, the airway tube has small antero-posterior diameter and large transverse diameter, which creates a larger inner lumen lacuna to reduce ventilation resistance. Meanwhile, similar figuration to pharynx shape makes it convenient to do endotracheal tube intubation. In particular, large transverse diameter could obviously reduce intubation resistance. The gastric access channel runs through the whole laryngeal mask airway. Its inlet slants outward and upward above the left fixed handle as 5 mm, and the outlet is located at the tip of the mask. It is convenient for placing the gastric tube and location test. The obtuse angle and the oval tube can reduce the resistance of endotracheal tube placement and keep the laryngeal mask airway stable. The outlet of the airway tube is circular and the bottom shape is rising wedge, which enables the endotracheal tube to enter the glottis accurately at the angle of 30 degrees. At the right side end of airway tube, there is a through tunnel plane which is formed by gastric access channel and the mask. The whole upper part of the gastric access channel forms an arch shape that connects with the bottom of the airway tube, making it easier to suck out the secretions. It is also a fence to epiglottis. When the epiglottis covers the outlet, the gastric access channel can prevent ventilation occlusion. The distal outlet of the gastric access channel is embedded in the rear of the mask tip with a shape of bevel, which facilitates the placement of laryngeal mask airway and reduces the damage of the tip to the tissue. At the same time, the gastric tube can accurately and rapidly enter the esophagus. Compared with the existing laryngeal mask airway, Blockbuster Laryngeal Mask Airway has simpler structure, easier to use, and could be well matched with the endotracheal tube and gastric tube. Blockbuster Endotracheal Tube. Blockbuster endotracheal tube is also called guiding endotracheal tube. Its tip is similar to the ventral upward pen tip, and the tip is shaped in the arc, upturned, centered, and flexible. The whole tip plays a role of self-guidance which can reduce the difficulty of intubation and the damage to the glottis and improve success rate of intubation. Meanwhile, the flexibility and deformability of the top also reduce the intubation difficulties after entering the glottis and reduce the damage to glottis as well as obviously increase the intubation success rate. Guiding endotracheal tube has depth marker line and longitudinal marker line in the rear matched with Blockbuster Laryngeal Mask Airway. Placement of Blockbuster Laryngeal Mask Airway. Lay the patient on his back. Tilt the head backward with a little pillow. Meanwhile, place the fixed band to the back of his neck. Open the patient's mouth with left hand to lift the jaw, and then place the laryngeal mask airway along with the mouth axis with right hand. Gently push his forehead with left hand to tilt the head when encountering resistance, and push forward the laryngeal mask airway in left-right rotating motion with right hand. If the whole mask enters the mouth, keep pushing with up-down maneuver. If it doesn't arrive at the right position, lift the patient's low jaw with both hands and at the same time, grip the wing-type fixed handle with 2 thumbs. Push forward the laryngeal mask airway with up-down maneuver until it arrives to the right position. Hook the band to the fixed handle. Then inflate the cuff with a syringe. The cuff pressure is about 30 centimeter water column. Connect the breathing circuit for positive airway pressure. Position judgment of Blockbuster Laryngeal Mask Airway. Smooth ventilation, appropriate pressure, ups and downs of the chest, and the end-tidal carbon dioxide pressure show good ventilation. Test the seal pressure or try the twice-tidal volume method in a short time. Leakage test. Drop gel into the gastric access channel inlet in positive airway pressure way to check its leakage. Check whether the depth is appropriate by observing the distance of the incisor and the wing-type fixed handle. Judge the location of the laryngeal mask airway by smoothness of gastric tube intubation. Visual location. Inspect the location of the laryngeal mask airway and exposure of glottis grade by inserting fiber optic bronchoscope or other fibroscope into the airway tube. Endotracheal tube exchange. Exposure of glottis grade is visually observed as 1-2 level via the laryngeal mask airway. Blind intubation can be realized by Blockbuster endotracheal tube and the success rate is higher than 95%. When intubating, Blockbuster endotracheal tube needs to be sufficiently lubricated. Pause breathing and insert the endotracheal tube into the laryngeal mask airway until the marking line reaches the fixed handle. Then gently push the endotracheal tube forward with the right hand until there is no resistance and desired depth is reached. Inflate the cuff, connect breathing circuit. If ventilation is smooth, continuous end-tidal carbon dioxide pressure can be shown on the ventilator screen. In that case, draw out the laryngeal mask airway with special tool and fix the endotracheal tube.